The shouting starts before I even see them. I'm halfway through my shift, walking from the break room back to the emergency department, when I hear it. A man's voice. Loud. Angry. Sharp enough to cut through the usual hospital noise. You never listen. You never think about anyone but yourself. Then a woman's voice. Just as loud. Just as furious. I'm the selfish one? Are you serious right now? You're the one who... I round the corner into the main lobby. And there they are. A couple. Mid-30s maybe. Standing near the automatic doors. He's tall, athletic build, wearing a business suit with the tie loosened. She's petite, dark hair pulled back in a ponytail, wearing yoga pants and a jacket. And they're screaming at each other. The waiting room has gone silent. Every patient, every visitor, every staff member is watching. Security guard Marcus is already moving toward them, his hand raised in a calming gesture. Folks, I'm going to need you to take this outside. Stay out of this, the man snaps, not even looking at Marcus. The woman's face is red, tears streaming down her cheeks. You don't get to tell me what I can and can't do. You don't own me. I'm trying to protect you, but you're too stubborn to see it. Protect me. You're controlling me. I should keep walking. This isn't my problem. Security will handle it. But something makes me stop. Maybe it's the desperation in their voices. Maybe it's the way they're both crying while they scream. Marcus tries again. Sir, ma'am, you can't do this here. There are sick people. We're leaving, the woman shouts. She turns toward the doors. I can't even look at you right now. Fine, go, see if I care. She storms toward the exit. He follows, still yelling. You know what? I'm done. I'm done trying. Good, so am I. The automatic doors slide open. They walk out into the parking lot, their voices fading but still audible. The lobby exhales. Conversations resume. Marcus shakes his head and returns to his post. I continue toward the ER, already forgetting about them. 20 minutes later, those same automatic doors burst open. The man stumbles through, carrying the woman in his arms. Her head lolls against his shoulder. Her face is gray. Her lips are blue. And he's screaming. But this time it's different. This time he's screaming for help. Please, somebody help me. She's not breathing. She's not breathing. I drop everything and run. St. Halstead Hospital's emergency department never sleeps. It's 11 p.m. on a Thursday, which means we're somewhere between the dinner rush and the midnight chaos. A steady stream of patients with various ailments. Nothing catastrophic yet. I've been on shift since 3 p.m. 8 hours down, 4 to go. My feet hurt. My back aches. I've had 2 cups of terrible coffee and half a protein bar. But I'm focused. Alert. Dr. Miriam Hale is supervising tonight. She's in Bay 6 with a patient who came in with chest pain, likely anxiety, but we're running cardiac enzymes to be sure. Lindsay, the pediatric nurse, is handling a kid with a fever in Bay 3. Carla is at triage, processing a new arrival. Everything is under control until the man bursts through the doors. I reach him in seconds. What happened? I don't know. We were in the parking lot and she collapsed. She's not breathing. I look at the woman in his arms. Mid-30s, unresponsive, skin pale and mottled, lips cyanotic, no visible chest rise. Get her on a gurney! Now! I shout. 2 nurses appear with a gurney. The man lays her down carefully, his hands shaking. I immediately check for a pulse. Carotid. Nothing. Radial. Nothing. No pulse! Starting CPR! I position my hands on her sternum and begin compressions, hard and fast. 1, 2, 3, 4. Carla appears beside me. What do we have? Unwitnessed collapse. No pulse, no respirations. Get me the crash cart. She's already moving. The man is hovering, his face desperate. Is she okay? Please tell me she's okay. Sir, I need you to step back, I say, not stopping compressions. Let us work. But step back. My voice is sharp, commanding. He stumbles backward. A security guard, Marcus, gently guides him to the side. The crash cart arrives. Lindsay tears open the woman's jacket, pulls up her shirt. Carla slaps the defibrillator pads on her chest. I pause compressions. Check the monitor. Ventricular fibrillation, a shockable rhythm. Charging to 200, everyone clear. I make sure no one is touching the patient. Clear. I press the button. The woman's body jerks. The monitor beeps. Still V-fib. Resume CPR. I start compressions again. Counting in my head, 30 compressions. Carla bags her, giving 2 breaths. Push 1 milligram of epi, I call out. Lindsay draws up the medication and injects it into the IV line Carla has already established. We work in synchrony. CPR, medications, defibrillation, everything by protocol. But she's not responding. 2 minutes pass. 4, 6. The monitor shows the same deadly rhythm. Dr. Hale appears. She takes one look at the situation and steps in. How long? 8 minutes since arrival. Unknown down time before that. She checks the monitor. Give her another round of epi. Shock again at 360. We follow her orders. Another shock. Another round of compressions. And then, the monitor changes. A blip, then another, then a rhythm. Sinus tachycardia. Fast, but organized. We have a pulse, Carla announces. I stop compressions. Check the carotid. She's right. Thready, but there. The woman gasps. Her chest rises. Once. Twice. She's breathing, Lindsay says, relief flooding her voice. I step back, my hands aching, my scrubs soaked with sweat. Let's get her intubated and into the ICU. Dr. Hale is already calling for the respiratory therapist. Good work, Reyes. Fast response saved her. I nod, still catching my breath. I look over at the man. He's standing against the wall, tears streaming down his face, his hands pressed against his mouth. 20 minutes ago, he was screaming at her in the lobby. Now he's watching us fight to keep her alive. And I have no idea what happened in between. We get her stabilized, intubated, sedated. Her vitals are shaky but holding. Heart rate, 110. Blood pressure, 90/60. Oxygen saturation, 94% on 100% oxygen. Not great, but alive. Dr. Hale orders a full workup. CBC, CMP, cardiac enzymes, toxicology screen, CT of the head and chest. We need to know why a healthy-looking woman in her 30s suddenly went into cardiac arrest. While the nurses prepare her for transport to radiology, I approach the man. He's still standing where Marcus left him, staring at the woman on the gurney like he's afraid she'll disappear if he looks away. Sir, I say gently, I'm Dr. Reyes. Can you tell me what happened? He tears his eyes away from her. Is she going to be okay? We're doing everything we can, but I need information. What's her name? Lauren Mitchell. And you are? Ryan Mitchell. Her husband. The couple from the lobby. Okay, Ryan, can you tell me what happened? You said she collapsed in the parking lot? He nods, running a hand through his hair. We were fighting. In the lobby. You probably saw us. I did, but I don't say that. We went outside, kept arguing, and then his voice breaks. She just stopped, mid-sentence. She looked confused, and then she grabbed her chest and fell. Did she say anything? Complain of pain? Shortness of breath? No, nothing. She was fine 1 second, and then he gestures helplessly toward the gurney. Does she have any medical history? Heart problems? High blood pressure? Diabetes? No, she's healthy. She runs marathons. She doesn't even take aspirin. That doesn't make sense. Healthy 30-something women don't just drop into cardiac arrest. Is she on any medications? Birth control? Supplements? Just birth control, that's it. Any recent illnesses, infections, injuries? No, she's been fine. I make notes on my tablet. Any family history of heart disease? He shakes his head. Not that I know of. What about drugs? Does she use anything recreational? His face hardens. No, never. Lauren doesn't even drink. I believe him, but I have to ask. Okay, one more question. What were you fighting about? He blinks. What? Why does that matter? Stress can trigger cardiac events. I need to understand what was happening before she collapsed. He looks away. It was stupid. We were arguing about starting a family. She wants to wait. I don't. It's been an ongoing thing. An argument about having kids. Stressful, yes. But enough to cause cardiac arrest? Unlikely. All right, we're going to run some tests. Find out what's going on. You can wait in the family room. Someone will update you as soon as we know more. Can I see her first? I hesitate. She's intubated, sedated, surrounded by machines. It's not an easy sight, but he's her husband. Briefly, I lead him to the bay. He approaches slowly like he's afraid to get too close. When he sees her, the tube in her throat, the monitors, the IV lines, he breaks down. Oh God, Lauren, I'm so sorry. He takes her hand, presses it to his forehead. Please don't leave me. Please. I'll do anything. Just don't leave me. I give him a moment, then I gently touch his shoulder. Ryan, we need to take her for scans. You'll have to wait outside. He nods, wiping his eyes. He leans down and kisses her forehead. I love you. I'm right here. I'm not going anywhere. He releases her hand and steps back. As we wheel her out, I see him collapse into a chair, his head in his hands, sobbing. 20 minutes ago, they were screaming at each other. Now he's terrified of losing her. And I still don't know why she arrested. The CT scans come back clean. No brain bleed, no pulmonary embolism, no aortic dissection. The cardiac enzymes are normal. No heart attack. The toxicology screen is negative. No drugs, no alcohol, no poisons. I'm standing at the nurse's station, staring at the results on the screen, trying to make sense of it. Dr. Hale appears beside me. Talk to me, Reyes. What are we missing? I don't know. Healthy 35-year-old woman. No medical history. No cardiac risk factors. Sudden cardiac arrest with VFib. But all the tests are negative. What about genetic conditions? Long QT syndrome, hypertrophic cardiomyopathy? Possible, but she's been running marathons. You'd think symptoms would have appeared before now. Not always. Sometimes the first symptom is sudden death. I frown. So what do? Get cardiology down here. We need an echo and an EKG, and I want a detailed family history. Sometimes these things run in families. I nod. I'll talk to the husband again. I find Ryan in the family waiting room. He's pacing. When he sees me, he rushes over. How is she? Stable for now. We're still running tests, but I need to ask you some more questions. Anything. You said there's no family history of heart disease, but what about sudden deaths? Anyone in her family die young? Unexpectedly? He thinks. Her dad died when she was 10. Heart attack, they said, but he was only 38. My pulse quickens. 38? Yeah. Lauren doesn't talk about it much. It really messed her up. Was there an autopsy? I don't know. Maybe? What about siblings? Does Lauren have any brothers or sisters? One brother, older. He's fine, I think. Any heart problems? Not that I know of. I make notes. A father who died suddenly at 38. That's significant. Ryan, I think Lauren might have a genetic heart condition, something that runs in families. It could explain the cardiac arrest. His face goes pale. What kind of condition? We won't know until we run more tests, but it's treatable. If we can figure out what it is, we can manage it. So she's going to be okay? I hope so, but we need to move fast. I leave him and head back to the ER. Dr. Hale is already on the phone with cardiology. They're sending someone down now, she says when she hangs up. 15 minutes later, Dr. Patel from cardiology arrives. She's a sharp woman in her 50s with gray hair and intense eyes. She reviews Lauren's chart, examines the EKG, and listens to my summary. You're thinking inherited arrhythmia syndrome, she says. Yes. Father died young. Sudden cardiac arrest with VFib. It fits. She nods. Let's get an echocardiogram. And I want genetic testing. We'll check for mutations in the genes associated with long QT, Brugada syndrome, and CPVT. How long will that take? The echo we can do now. Genetic testing will take a few days. But if this is what I think it is, we need to start treatment immediately. I'll order beta blockers and consider an ICD if she stabilizes. An ICD, an implantable cardioverter defibrillator, a device that shocks the heart if it goes into a dangerous rhythm. Will that prevent another arrest? If we get the diagnosis right and manage it properly, yes. She can live a normal life, but she'll need to be monitored closely. I feel a weight lift. There's a path forward. Dr. Patel goes to perform the echo. I return to Ryan. We think we know what's wrong, I tell him. Lauren likely has a genetic heart condition that causes dangerous rhythms. Her father probably had the same thing. Can you fix it? We can manage it. She'll need medication and possibly a device implanted in her chest to monitor her heart. But yes, she can recover from this. He sags with relief. Thank you. Thank you so much. There's something else. If Lauren has this condition, there's a chance her brother has it too. And any children she has would be at risk. They should all get tested. His face changes. Children. Yes, he's quiet for a long moment. Then, we were fighting about having kids. She wanted to wait. I was pushing her. And now, if she'd gotten pregnant, if she'd had a baby, and this happened, he trails off, the realization hitting him. She might have been protecting herself without even knowing it. I say gently. He closes his eyes. God, I've been such an idiot. I don't respond to that. Instead, I say, the important thing now is that we know, and we can treat it. He nods slowly. What happens next? Dr. Patel will do some more tests. We'll start Lauren on medication, and once she's stable, we'll talk about the ICD. How long will she be in the hospital? At least a week, maybe more. Can I stay with her? Family can visit during ICU hours, but she won't be awake for a while. We need to keep her sedated to let her body recover. I don't care. I just want to be close to her. I understand that. I'll see what I can arrange. 2 hours later, Dr. Patel completes the echocardiogram. She calls me into the viewing room to show me the results. Look at this, she says, pointing to the screen. I see Lauren's heart contracting. It looks normal at first, but then Dr. Patel highlights a section of the left ventricle. See that? The wall is thickened. Not dramatically, but enough to be significant. Hypertrophic cardiomyopathy? Possibly. Or it could be part of an arrhythmogenic syndrome. The EKG shows some abnormalities too. Prolonged QT interval. I'm fairly confident this is long QT syndrome, possibly type 1 or 2. Long QT syndrome, a genetic condition that affects the heart's electrical system. It can cause sudden, uncontrollable heart rhythms that lead to fainting, seizures, or sudden death. What triggered the arrest? I ask. Could be anything. Stress, adrenaline, strong emotions. In patients with LQTS, emotional or physical stress can be enough to set off a fatal arrhythmia. The fight, the screaming, the anger and tears, that's what triggered it. So the argument literally almost killed her, I say quietly. Yes, but it also saved her life. I look at her, confused. If she'd been alone when this happened, at home, in her car, anywhere without immediate access to medical care, she'd be dead. The fact that it happened in a hospital parking lot, with her husband there to bring her inside immediately, is the only reason she survived. I think about that. The cruel irony of it. They were fighting, saying terrible things to each other, on the verge of walking away, and that fight brought them to the one place that could save her. I'm going to start her on beta blockers, Dr. Patel continues. Once she's stable, we'll implant an ICD, and I'll refer her for genetic counseling. If she wants to have children, we'll need to manage it very carefully. What's the prognosis? With proper treatment and monitoring? Excellent. She can live a full, normal life, but she'll need to avoid certain triggers. High stress, intense exercise without supervision, some medications, and she'll need regular follow-ups. I nod. Thank you, Dr. Patel. Thank you for the fast response. Your CPR kept her brain perfused. If there's no anoxic injury, it's because of you. I don't feel like a hero. I was just doing my job, but I'll take the compliment. I go back to find Ryan. He's still in the waiting room, now sitting with his head against the wall, eyes closed. Ryan, he jerks awake. What? Is she? She's stable. We have a diagnosis. Long QT syndrome. It's genetic, treatable. She's going to need medication and a device implanted, but she should make a full recovery. He breaks down again, but this time it's relief. Can I see her? Not yet. She's still sedated, but soon. He nods, wiping his face. I don't know how to thank you. You don't have to thank me. But Ryan, when she wakes up, you two need to talk. Really talk. About what happened. About what this means. I know. I will. I just want her to be okay. She will be. I leave him there and return to the ER. My shift is almost over, but I can't leave until I know Lauren is stable. Dr. Hale finds me at the nurse's station. You did good work tonight, Reyes. Just following protocol. No, you saw something everyone else missed. The family history, the genetic connection. That's what made the difference. I shrug. I got lucky. Luck is what happens when preparation meets opportunity. You were prepared. She walks away, leaving me with her words. I think about Lauren and Ryan, about their fight, about how close they came to losing everything. And I think about how fragile life is, how quickly things can change. One moment, you're screaming at someone you love. The next, you're begging for their life. The ICU at St. Halsted is on the 4th floor. It's quieter than the ER, more controlled. The beeping of monitors creates a constant rhythm. The fluorescent lights are dimmed. Nurses move through the hallways with practiced silence. Lauren is in room 407. I check on her before I leave for the night. She's lying still, the ventilator breathing for her. Her face is peaceful in sedation. The monitors show stable vital signs, heart rate steady, blood pressure holding, oxygen saturation good. Ryan is sitting in a chair beside her bed. He hasn't left. You should go home, I tell him. Get some rest. She's stable. We'll call you if anything changes. He shakes his head. I can't. What if she wakes up and I'm not here? She won't wake up tonight. We're keeping her sedated for at least 48 hours. I don't care. I'm staying. I don't argue. I understand. The cafeteria is on the 1st floor. There's a family lounge down the hall with a couch if you need to sleep. Thank you. I turn to leave, then pause. Ryan? Can I ask you something? Sure. How long have you and Lauren been married? 8 years. And you love her? He looks at me like I've asked the stupidest question in the world. More than anything. Then why were you fighting like that? He's quiet for a long moment. Then he sighs. Because I'm an idiot. Because I thought I knew what was best for us. Because I wasn't listening to what she was actually saying. What was she saying? That she was scared. That she wasn't ready. That she needed time. He looks at Lauren. But I kept pushing. I thought if I could just convince her, she'd see it my way. I didn't realize I was making her feel trapped. And now? Now I realize none of it matters. The arguments, the timeline, the plans. All I want is for her to be okay. To have another chance. You'll get that chance. I hope so. I leave him there, sitting vigil beside his wife. When I return to the hospital the next morning, my shift doesn't start for another hour. But I want to check on Lauren. I find Dr. Patel in the ICU, reviewing Lauren's overnight vitals. How is she? I ask. Stable. Heart rhythm has been normal all night. No arrhythmias. The beta blockers are working. When will you wake her up? Tomorrow, if everything continues to look good. I want to make sure her heart is stable before we extubate. And the ICD? We'll schedule it for next week. Give her a few days to recover from the arrest first. I nod. Has her brother come in for testing yet? He has an appointment this afternoon. I'm seeing him myself. Good. I head down to the ER to start my shift, but my mind keeps drifting back to Lauren, to Ryan, to the fight that almost ended in tragedy. The morning is busy. A construction worker with a nail through his hand, an elderly woman with pneumonia, a teenager who overdosed on her mother's pain medication. I treat them all with the same focus and care, but in the back of my mind, I'm thinking about Lauren, about how one moment can change everything, about how we never know which breath might be our last, about how important it is to say the things that matter while we still can. Over the next 36 hours, Ryan never leaves the ICU. He sleeps in the chair beside Lauren's bed, eats vending machine food, showers in the family lounge bathroom. The nurses bring him blankets, pillows, coffee. He barely notices. All his attention is on Lauren, on the monitors, on the rise and fall of her chest as the ventilator breathes for her. I check on them during my shifts. Sometimes I just stand in the doorway watching. Ryan talks to her constantly, telling her about his day, apologizing, making promises. I'm sorry I didn't listen. I'm sorry I made you feel like your feelings didn't matter. I promise, when you wake up, things will be different. We'll figure it out together. Whatever you want, whatever you need, I'm here. He holds her hand, strokes her hair, kisses her forehead. The nurses tell me he cries a lot, especially at night when he thinks no one is watching, but he never gives up hope. On the second day, Dr. Patel decides Lauren is stable enough to wake up. I'm there when they start lightening the sedation. Ryan sits forward in his chair, his eyes locked on Lauren's face. Come on, baby, he whispers. Wake up. Please wake up. It takes time. The medications need to clear her system. But slowly, her eyelids start to flutter. Her fingers twitch. And then her eyes open. She looks confused, disoriented. The endotracheal tube in her throat makes her gag. It's okay, Dr. Patel says soothingly. You're in the hospital. You're safe. We're going to take the tube out now. Just try to relax. The respiratory therapist removes the tube. Lauren coughs, gasping. Ryan is on his feet. Lauren, I'm here. She turns her head toward his voice. Her eyes focus on him. Ryan? Her voice is hoarse, barely a whisper. I'm here. I'm right here. She tries to speak, but her throat is too dry. A nurse brings water. Ryan helps her take small sips. After a moment, she tries again. What happened? You collapsed, Ryan says. Your heart stopped, but the doctor saved you. She looks at me, at Dr. Patel, at the monitors surrounding her. I don't remember. That's okay, Dr. Patel says. That's normal. What's important is that you're awake. You're doing great. Lauren's eyes fill with tears. I'm scared. Ryan takes her hand. I know, but you're going to be okay. We're going to get through this, together. She looks at him, really looks at him. We were fighting. I know. I said terrible things. So did I. I'm sorry. I'm sorry too. They're both crying now. But it's different from the crying in the lobby. This is relief, gratitude, love. Dr. Patel and I quietly step out of the room, giving them privacy. She's going to be okay, Dr. Patel says. Yeah, she is. Later that afternoon, I'm finishing up paperwork when Dr. Patel pages me. Reyes, I need you in the cardiology clinic. Now. I head upstairs. When I arrive, I find Dr. Patel with a man in his late 30s. He looks like Lauren. Same dark hair, same facial structure. Doctor, Reyes, this is Marcus Mitchell, Lauren's brother. We shake hands. Marcus came in for screening, Dr. Patel continues. We did an EKG and an echo. Her expression tells me everything I need to know. He has it too, I say. Yes, long QT syndrome. Same mutation as Lauren. Marcus looks shaken. I had no idea. I've never had any symptoms. That's common, Dr. Patel says. Some people with LQTS never have symptoms until they have a cardiac event. You're lucky we caught it before that happened. What do I do now? We start you on beta blockers immediately, and we monitor you closely. You may need an ICD as well, depending on how you respond to medication. Will I be okay? Yes. With proper treatment, you should live a normal life, but you need to be careful. Avoid intense stress, certain medications, high-intensity exercise without supervision. He nods, trying to absorb it all. There's one more thing, Dr. Patel says. Do you have children? 2, a boy and a girl. 6 and 8. They need to be tested as soon as possible. His face goes pale. You think they might have it too? It's a 50-50 chance for each child. But if they have it, we need to know. We can start treatment early and prevent what happened to Lauren. Oh God, I step in. Marcus, I know this is overwhelming, but knowledge is power. The fact that we know about this condition now means we can protect your kids. We can protect you. He takes a shaky breath. Okay, I'll bring them in. Dr. Patel schedules the appointments. Marcus leaves, looking dazed. After he's gone, Dr. Patel turns to me. This family is lucky. If Lauren hadn't arrested when and where she did, we might never have discovered this. Marcus might have died suddenly. His kids might have grown up with an undiagnosed condition. One near tragedy preventing multiple future tragedies. Exactly. I think about that. About how one moment, one terrible, frightening moment, can ripple outward and save so many lives. Lauren's cardiac arrest was devastating, traumatic, life-threatening, but it was also a gift, a warning that came just in time. Lauren improves rapidly over the next few days. The ventilator is removed. She's breathing on her own. Her heart rhythm stays stable. The medications are working, but she's struggling emotionally. I find her crying one afternoon when I stop by to check on her. Ryan has gone home to shower and change clothes, the first time he's left the hospital in 4 days. Hey, I say gently. You okay? She wipes her eyes. I don't know. I pull up a chair. Want to talk about it? She's quiet for a moment. Then, I keep thinking about my dad, about how he died when I was 10, and how I almost did the same thing. Almost left Ryan the way my dad left me, but you didn't. Only because I was lucky, because I collapsed in the right place at the right time. What if next time I'm not so lucky? That's why you're getting the ICD, to make sure there isn't a next time. But what if it doesn't work? What if I drop dead anyway? I lean forward. Lauren, I can't promise you that nothing bad will ever happen. Medicine isn't magic, but I can tell you that with proper treatment, your chances of living a long, healthy life are excellent. This condition is manageable, but my dad didn't manage it. He died at 38. Your dad didn't know he had it. He never got a diagnosis, never got treatment. You have both. That makes all the difference. She nods slowly. Dr. Patel said I can still have kids, if I want to. You can. It'll require careful monitoring, but yes. What if the baby has it too? Then we'll know early. We can start treatment right away. Medical science has come a long way. Kids with LQTS can live completely normal lives now. She's quiet for a long moment. Then, Ryan and I were fighting about having kids. That's what started all of this. I know. I told him I wasn't ready, that I wanted to wait. But the truth is, I've been scared, terrified actually, of dying young like my dad, of leaving a child without a parent. That's understandable. But now I realize something. My dad didn't choose to leave me. He didn't know what was wrong with him. But I do. I have a choice. I can choose to get treatment, to take care of myself, to be there for my family. That's right. So maybe I can do this. Maybe I can have the life I want instead of the life I'm afraid of. I smile. I think you can. She smiles back. Small, tentative, but real. Thank you, Dr. Reyes, for saving my life and for helping me see things differently. You're welcome. A week after her cardiac arrest, Lauren is strong enough for the ICD implantation. It's a relatively simple procedure, performed under local anesthesia with conscious sedation. Dr. Patel performs it herself. I'm not in the room. but I follow the progress from the ER. The procedure takes about an hour. The device is implanted just under the skin below Lauren's left collarbone. Leads are threaded through her veins into her heart. The device is programmed to monitor her heart rhythm constantly and deliver a shock if it detects a dangerous arrhythmia. It's a lifeline, a safety net. When it's over, Lauren is moved to a recovery room. Ryan is there when she wakes up. I stop by later to check on her. "How are you feeling?" I ask. She touches the small bulge under her skin where the device sits. "Weird. I can feel it when I move." "You'll get used to it." "Will it go off a lot?" "Hopefully never. The beta blockers should keep your heart rhythm stable. The ICD is just a backup, insurance. But if it does go off, it'll feel like being kicked in the chest. Not pleasant, but it'll save your life." She nods. "Better than the alternative?" "Exactly." Ryan is holding her hand. He hasn't let go since she woke up. "When can she go home?" he asks. "Tomorrow, if everything looks good. She'll need to take it easy for a few weeks while the incision heals. No heavy lifting, no strenuous activity. But after that, she can gradually return to normal life." "What about running?" Lauren asks. "I have a marathon in 3 months." Dr. Patel appears in the doorway. "Let's start with walking and see how you do. We'll reassess in a few weeks." Lauren looks disappointed, but nods. "Okay. The important thing," Dr. Patel continues, "is that you listen to your body. If you feel dizzy, lightheaded, or your heart racing, stop what you're doing and check in with me. Don't push through it." "I won't." "Good, because you're going to be fine, but only if you take care of yourself." Lauren squeezes Ryan's hand. "I will. I promise." 2 weeks later, the results come back on Marcus's children. The daughter, Emma, is negative. She doesn't have the mutation. The son, Ethan, is positive. Marcus brings him to the hospital for a consultation. The boy is 6 years old, small for his age, with curious eyes and a shy smile. Dr. Patel explains the diagnosis to Marcus and his wife, Jennifer, in terms they can understand. Ethan will need medication, regular monitoring, lifestyle modifications, but he can still be a kid. He can still play. He can still have a normal childhood, just a carefully monitored one. After the consultation, Marcus pulls me aside. "I talked to Lauren yesterday. She told me about you, about what you did. I was just doing my job. No, you saved my sister's life, and by doing that, you saved mine, and my son's, our whole family. I don't know what to say to that." "Thank you," he says simply. From the bottom of my heart, I shake his hand. "Take care of that boy." "I will. I promise." I watch him return to his family. Jennifer has her arm around Ethan, talking to him softly. Marcus joins them, and they walk out together. A family, whole, protected, because of one cardiac arrest. One moment of crisis that revealed a hidden danger and gave them the chance to face it. 6 weeks after Lauren's cardiac arrest, she's discharged from follow-up care. Her heart rhythm has been stable. No arrhythmias. The ICD hasn't fired once. The medications are working. She's healed. Before she leaves, she asks to see me. I find her in the cardiology clinic waiting room with Ryan. They're both smiling, relaxed, different from the angry, desperate couple I first saw in the lobby. "Dr. Reyes," Lauren says, standing to hug me. "I wanted to say goodbye, and thank you. One more time. You're welcome. How are you feeling?" "Good, strong, ready to move forward." "That's great. Remember to follow up with Dr. Patel regularly." "I will." She hesitates. Then, "Can I tell you something?" "Of course." "Ryan and I have been talking. A lot. About everything. About our marriage. About what we want. About the future. And we're going to try. For a baby. Not right now. Dr. Patel wants my condition stable for at least 6 months first. But eventually." I smile. "That's wonderful. I know it's risky, but I also know that life is risky. And I don't want to live in fear anymore. My dad died young, but that doesn't mean I have to. I can have the life he never got to have. That's the right attitude." Ryan puts his arm around her. "We're also doing couples therapy, working on communication, making sure we actually talk to each other instead of just fighting." I laugh. "That's probably a good idea." Lauren looks at me, her eyes serious. "That fight we had, the one you saw in the lobby, it was the worst moment of our marriage. We said things we didn't mean, things that hurt. I remember. But it also saved my life. If we hadn't been here, if I'd collapsed at home or at work, I'd be dead. That fight brought me to the right place at the right time. Sometimes the worst moments lead to the best outcomes." "Yeah, they do." She reaches out and hugs me again. "Thank you, Dr. Reyes, for everything. Take care of yourself, Lauren." "I will." They gather their things and walk out. I watch them go, hand in hand, talking quietly. They came in fighting. They're leaving together, stronger than before. 3 months after Lauren's cardiac arrest, I receive an email. It's from Marcus. Attached is a photo of his son, Ethan, at a soccer game. He's running across the field, a huge grin on his face, completely unaware of the medical device monitoring his heart. The email reads, "Dr. Reyes, I wanted to update you on Ethan. He's doing great. The medication is working perfectly. No symptoms, no problems. He's just a normal kid living a normal life. But he wouldn't be here. None of us would be here if you hadn't saved Lauren that night, if you hadn't asked the right questions, if you hadn't made the connection. You didn't just save my sister, you saved our entire family. Thank you, Marcus." I stare at the photo for a long time, at the boy who would have grown up with an undiagnosed heart condition, who might have collapsed during that soccer game, who might have died, but now he's protected, monitored, safe, because of one cardiac arrest, one moment of crisis, one decision to dig deeper and ask questions. I forward the email to Dr. Hale with a simple note. "Thought you'd want to see this." She responds within minutes. "This is why we do what we do." And she's right. This is why. That night, after my shift ends, I sit in the hospital cafeteria with a cup of coffee. It's 2 a.m. The place is nearly empty. Dr. Hale appears carrying her own coffee. "Mind if I sit? Please." She settles into the chair across from me. "Heard Lauren Mitchell had her 3-month follow-up today." "Yeah, she's doing great." "Good save, Reyes. Really good. Thanks." We sit in comfortable silence for a moment. Then Dr. Hale says, "Cases like this remind me why I became a doctor." Yeah, we see a lot of death, a lot of loss, a lot of moments where we can't do anything but watch. But every once in a while, we get a case like this, where everything we do matters, where we actually save someone. It feels good. It does. But it's also a reminder. Of what? That medicine isn't just science. It's not just protocols and procedures and algorithms. It's about people, about stories, about the moments that define lives. She takes a sip of her coffee. Lauren and Ryan came in at the worst moment of their marriage, fighting, angry, ready to give up on each other. And in that moment, when everything seemed broken, medicine stepped in. We fixed her heart. But in doing that, we gave them a chance to fix their relationship. Do you think they'll make it? I think they have a better chance now than they did before. And that's something. I think about that. "You know what I learned from this case?" I say. "What?" "That timing is everything. If Lauren had collapsed 5 minutes earlier, before they came to the hospital, she might have died in the parking lot. If it had happened 5 minutes later after they'd driven away, same thing. But it happened in that exact window, right when help was available. Fate? Maybe. Or maybe just luck. But either way, it worked out." Dr. Hale smiles. "Sometimes that's all we can ask for." She finishes her coffee and stands. "Get some rest, Reyes. You earned it. You too." She walks away, leaving me alone with my thoughts. I think about Lauren and Ryan, about Marcus and his family, about all the lives touched by one moment of crisis. And I think about the fight in the lobby, the screaming, the anger, the tears. 20 minutes later, he was begging me to save her. And I did. We did. Because that's what we do. We fight for life, even when life seems to be fighting against us. We find hope in the darkest moments, and we hold on, no matter what. 4 months after Lauren's cardiac arrest, I'm sitting in the ER staff lounge during my break when Carla pokes her head in. "Noah, someone's asking for you at the front desk." I set down my sandwich. "Who?" "Didn't give a name, just said it was important." I follow her out to the waiting room, and there, standing by the entrance, is a woman I don't recognize at first. She's in her 60s, gray hair, wearing a cardigan and carrying a purse. Then I see the family resemblance, the eyes, the chin. "Dr. Reyes?" she says, approaching me. "Yes, I'm Patricia Delgado, Lauren's mother." Lauren's mother. I hadn't even thought about her parents. Ryan mentioned her father died young, but I never asked about her mother. "Mrs. Delgado, it's nice to meet you. I wanted to thank you," she says, her voice trembling, "for saving my daughter's life. I was just doing my job." She shakes her head. "No, you did more than that. Lauren told me everything. How you figured out what was wrong. How you connected the dots about her father." Her eyes fill with tears. "My husband, Roberto, died when Lauren was 10. Heart attack, they told us. But there was never an autopsy. Never any explanation of why a healthy 38-year-old man would just drop dead. I'm sorry for your loss." For 30 years, I've wondered. I've blamed myself. Thought maybe if I'd seen the signs, if I'd made him go to the doctor, if I'd done something different. She wipes her eyes. But now I know. It wasn't my fault. It wasn't anyone's fault. He had a condition no one knew about. And because you saved Lauren, because you figured it out, now we know. Now my grandson is protected. Now my daughter can have a future. She reaches out and takes my hand. You gave me something I never thought I'd have. Peace, understanding. The knowledge that my husband's death wasn't meaningless. It helped save his daughter, his grandson. I don't know what to say. Thank you, she whispers. Thank you for giving me my daughter back and for giving meaning to my husband's death. She hugs me. Quick, tight. Then she steps back, wipes her eyes, and walks out. I stand there for a long moment, watching her go. Carla appears beside me. You okay? Yeah, I didn't realize how far the ripples went. They always do. Every life we save touches dozens of others, hundreds sometimes. I know, but knowing it and seeing it are different things. She pats my shoulder. That's what makes this job hard and beautiful. I'm in the ER on a quiet Tuesday afternoon when Carla calls me to the front desk. Noah, you have visitors. I look up from the chart I'm reviewing. Who? Come see. I walk to the waiting room, and there they are. Lauren and Ryan Mitchell, but they're not alone. Lauren is glowing. Her hand rests on her belly, a small but unmistakable bump. Dr. Reyes, she says, smiling wide. I can't help but smile back. Lauren, Ryan, this is a surprise. We wanted to tell you in person, Ryan says. We're having a baby. My chest fills with warmth. That's incredible. Congratulations. 12 weeks, Lauren says. Everything's looking good so far. Dr. Patel is monitoring me closely. Weekly appointments, extra ultrasounds, the works. And you're feeling okay? A little nauseous in the mornings, but otherwise great. The ICD is working perfectly. My heart rhythm has been stable. I'm so happy for you both. Ryan puts his arm around Lauren. We wouldn't be here without you. Any of this. So we wanted to say thank you. Again. You don't have to keep thanking me. We know, but we want to. Lauren reaches into her bag and pulls out an envelope. We also wanted to give you this. I open it. Inside is a photo. It's an ultrasound image. Black and white, grainy, but clear enough to see the tiny form of a baby. And written on the bottom in Lauren's handwriting, Baby Mitchell. Due March 15th. Our little miracle. We want you to have it, Lauren says. As a reminder that what you do matters. That you saved more than just my life that night. You saved our family, our future. I stare at the photo, at the tiny life growing inside her. A life that almost never had a chance. Thank you, I say, my voice thick. This means more than you know. We talk for a few more minutes. They tell me about the nursery they're planning, the names they're considering, the excitement and terror of impending parenthood. And then they leave, hand in hand, ready to face whatever comes next. I stand there in the waiting room, holding the ultrasound photo. Carla appears beside me. That's beautiful. Yeah, it is. You did that, you know. You made that possible. We did that. All of us. She smiles. True. But you were the one who saw them that night, who ran to help, who refused to give up. I think about that night, the shouting, the chaos, the desperate fight to save a life. And I think about now, the joy, the hope, the new beginning. Sometimes, I say quietly, the worst moments lead to the best outcomes. Yeah, Carla says, they do. 13 months after Lauren's cardiac arrest, I receive a package at the hospital. Inside is a baby blanket, soft, blue, with tiny stars embroidered on it, and a card. I open it. On the front is a photo. Lauren and Ryan sitting together on a couch, smiling at the camera. And between them, a tiny baby. Perfect, healthy, beautiful. I open the card. Dr. Reyes, meet Samuel Ryan Mitchell. Born March 18th at 7:32 a.m., 7 pounds, 6 ounces. Healthy and perfect. We tested him for long QT syndrome. He doesn't have it. He's clear. We named him Samuel after Ryan's grandfather. But his middle name, Ryan, is also for you. Because you gave us the chance to become parents. You gave us this life. We will never forget what you did for us. And we will make sure Samuel knows the story of how close he came to never existing, and how a doctor who refused to give up saved his mommy's life. With eternal gratitude, Lauren, Ryan, and Samuel, I stare at the photo for a long time, at the baby who exists because his mother survived, at the family that was almost destroyed but instead was reborn, at the love that almost ended but instead grew stronger, all because of one moment, one cardiac arrest, one fight in a hospital lobby, and 20 minutes later, a man begging me to save her. I did. We did. And now there's a new life in the world because of it. I pinned the photo to the bulletin board in the break room, right next to the ultrasound image Lauren gave me months ago. A before and after, a promise and a fulfillment, a reminder of why we do what we do. 6 months after Samuel is born, I'm invited to speak at a regional emergency medicine conference. The topic, recognizing inherited cardiac arrhythmias in the emergency department. I almost decline. Public speaking isn't my favorite thing, but Dr. Hale convinces me. You have a story to tell, Reyes, a case that saved multiple lives. Other doctors need to hear it, so I agree. The conference is held at a hotel downtown, 300 emergency physicians from across the region. I'm scheduled to speak on the second day. When my turn comes, I walk to the podium. My hands are shaking, my mouth is dry, but then I think about Lauren, about Marcus, about Ethan, about Samuel, and I begin. 13 months ago, a couple came into St. Halstead Hospital. They were fighting, screaming at each other in the lobby. Security was about to escort them out. I pause. Let that sink in. 20 minutes later, the husband burst back through the doors carrying his wife in his arms. She wasn't breathing. Her heart had stopped. I click to the next slide. Lauren's EKG. The prolonged QT interval clearly visible. This is what saved her life. Not the defibrillation, not the CPR. Those kept her alive. But this single finding on an EKG is what changed everything. I walk them through the case, the family history, the genetic testing, the discovery of her brother's condition, the testing of his children. Because we asked the right questions, because we looked beyond the obvious, we didn't just save one life, we protected an entire family. I click to the final slide, the photo of Samuel, Lauren and Ryan smiling beside him. This baby exists because we took the time to figure out why his mother arrested, because we didn't just treat the symptoms, we found the cause. I look out at the audience, 300 faces, listening, engaged. How many of you have seen a young, healthy patient in cardiac arrest? And how many of you have asked about family history of sudden death? A few hands go up. Not many. This is my challenge to you. When you see the unexplained arrest, when the tests come back negative, when everything seems normal except the patient is dying, dig deeper. Ask about family. Ask about sudden deaths. Ask about the things that don't make sense, because that's where the answers are. I step back from the podium. The room erupts in applause. Afterward, several doctors approach me, asking questions, sharing their own cases, thanking me for the presentation. One woman, a young resident, pulls me aside. I had a case like this 3 months ago, she says. 20-year-old woman, collapsed at the gym. We resuscitated her, but all the tests were negative. I didn't think to ask about family history. What happened? She arrested again 2 weeks after discharge, at home, alone. She didn't make it. Her eyes fill with tears. If I'd heard your talk before then, if I'd known to ask, I put my hand on her shoulder. You can't change the past, but you can learn from it. The next patient you see, you'll know what to ask. She nods, wipes her eyes. Thank you. As I leave the conference, I think about that resident, about the patient she lost, about the patients she'll save in the future because of what she learned. The ripples keep spreading. One case, one presentation, dozens of doctors, hundreds of future patients, all because Lauren and Ryan fought in a lobby, and 20 minutes later, he begged me to save her. 2 years after Lauren's cardiac arrest, St. Halstead Hospital holds its annual community health fair. It's a Saturday in May, warm, sunny. The hospital parking lot is filled with booths, health screenings, information tables, food trucks. I'm working the cardiology booth with Dr. Patel. We're offering free blood pressure checks and EKGs, educating people about heart health. Around noon, I see them, Lauren and Ryan, walking hand in hand, and between them, a toddler, chubby legs, curly hair, a bright blue shirt, Samuel. They see me at the same moment. Lauren waves. They head over. Dr. Reyes, Lauren says, beaming. I was hoping we'd see you. Lauren, Ryan, and this must be Samuel. The little boy hides behind his mother's legs, suddenly shy. He's going through a phase, Ryan says, laughing. Stranger danger and all that. He's beautiful. He is, Lauren agrees, and healthy. No heart problems, no issues at all. That's wonderful. Samuel peeks out from behind Lauren. I crouch down to his level. Hi, Samuel. I'm Noah. I'm a friend of your mom and dad. He stares at me with big brown eyes. Then he holds up a toy car. Car? That's a cool car. He smiles, then hides again. Lauren laughs. He'll warm up. He always does. We chat for a while. They tell me about life with a toddler, the sleepless nights, the endless energy, the joy. We're thinking about having another, Lauren says quietly. Really? Yeah. Dr. Patel says my heart is stable enough, and Samuel needs a sibling, right? Ryan grins. We're working on it. I smile. That's great. Really great. Dr. Patel appears with pamphlets about genetic testing. Lauren, perfect timing. Can you talk to some of these people about your experience? Of course. For the next hour, Lauren shares her story. With strangers, with families, with anyone who will listen. She tells them about her cardiac arrest, about the diagnosis, about the ICD, about the genetic testing that saved her brother and nephew. She's passionate, articulate, unashamed, and people listen. I watch from a distance, amazed. 2 years ago, she was dying on a gurney, surrounded by machines, fighting for every breath. Now she's here, alive, thriving, helping others. The ripples never stop. I keep the baby blanket in my locker, folded neatly, a symbol of hope. It reminds me that every patient who comes through those doors has a story, a life, a future, and sometimes our actions ripple far beyond what we can see. Lauren came to the hospital fighting with her husband, angry, hurt, on the verge of walking away. 20 minutes later, she was dying, but we brought her back, and in bringing her back, we saved so much more than just her life. We saved a marriage, a family, multiple families. We protected children who hadn't even been born yet. We turned a moment of crisis into a moment of revelation, and we gave people the chance to choose differently, to live differently, to love differently. That's the power of medicine. Not just fixing what's broken, but creating opportunities for healing that go far deeper than the physical body. Lauren and Ryan fought in the lobby that night, screamed terrible things at each other, said words they couldn't take back. But those words didn't matter in the end. What mattered was that when crisis came, love won. Ryan didn't run. He didn't walk away. He picked her up and brought her to us. And we fought for her. And she lived. And they healed. And now there's a baby named Samuel, running through his house, laughing and playing, completely unaware of how close he came to never existing. And somewhere, Patricia Delgado sleeps peacefully at night, no longer haunted by her husband's death, because she knows it wasn't her fault. Because she knows his death helped save his daughter and grandson. And somewhere Marcus Mitchell watches his son play soccer, grateful that Ethan will grow up healthy and protected. And somewhere, a young doctor hears my presentation and asks the right questions, and saves a life. That's why I'm here. That's why I do this. Not for the glory, not for the recognition, but for moments like these, for the chance to stand between life and death and choose life, for the opportunity to turn tragedy into triumph, for the privilege of witnessing love survive its darkest hour. They fought in the lobby. 20 minutes later, he was begging me to save her, and I did, because that's what we do. We save lives, and in doing so, we save the world. One patient at a time, one family at a time, one moment at a time. Every day, I walk through those automatic doors, the same doors Lauren stumbled through 2 years ago, the same doors that Ryan burst through carrying her dying body, and I remember that every second counts, every question matters, every decision has consequences, and every life is worth fighting for, no matter how broken it seems, no matter how hopeless it looks, no matter how loud the fighting gets, because 20 minutes can change everything. And sometimes, the worst moments lead to the best outcomes. That's the lesson Lauren taught me. That's the gift she gave me. And I carry it with me every single day.